The huzzah for the Affordable Care Act. The president and the vice president appearing in the Rose Garden some 48 hours ago, and then before that we had endless announcements of 7.1 million, mission accomplished. What James and I featured in our conversation yesterday, and then I want to go to your conversation with James the day before, Mary, is the president saying the debate on the Affordable Care Act, on Obamacare, is over. James's dry, humorous remark was premature. So, Mary, we don't have any numbers. We don't have any numbers at all about what happened, or why we don't have numbers. Did you get any explanation why we're not seeing any more clarity than 7.1 million year?
Because it's not politically expedient for the administration to give us any more clarity, John. If it were in their political interest to release details about the fabric, the makeup of these numbers, how many people were uninsured before who now have insurance, how many of them are sick versus healthy, how many of them are young versus old, all of these things. The real guts of the numbers, which is what you need to make sense of 7.1 million. Otherwise, it's just gobbledygook, John. It means nothing.
Until now, all we have is anecdotes, and we have anecdotes that suggest that there are troubles, but we don't have any evidence yet. Now, I will assert this. We will get numbers. There are 400 healthcare insurance companies on the Affordable Care Act, healthcare.gov, participating. They all know who's paid and how old they are and where they are and who they are. We'll eventually get that. We don't have it yet, so we're going to go to the center of the country right now. Gene Countryman is at Wichita, Kansas. This is a red state, a quiet, self-possessed red state that is extremely confident in the history of the United States since the Civil War. Kansas. This is Wichita, Kansas, which is a manufacturing hub associated with the great success of American airplanes. Right now, however, we're going to Gene for the anecdotes throughout the state of Kansas about the Affordable Care Act. Mr. Countryman, a very good evening to you. The reporting in the papers, in the local papers I followed in these last 24 hours, is no more determinative than we have at the national level. However, what I'm keen on is hearing the anecdotes from those navigators and those Kansans who have signed up. Is there any indication that this was a success, that Kansas is celebrating a large number of sign-ups, that these are young people? What can you tell us, Gene? Good evening to you.
Well, good evening, John and Mary. Well, the anecdotes are pretty much what you'd expect. I mean, yes, they say that there was a big surge at the end of the enrollment period, that the phone lines were jammed. Well, I'm not sure what that meant exactly, but there were a lot of people. Some said they had people, lined up waiting to enroll, but there aren't any numbers. And the only numbers we had were at the end at the 1st of March, where there were about 29,000 in Kansas. And Kansas did not do its own health exchange. Kansas is participating in the federal exchange. And so it's the anecdotes are very positive, but it's sort of like I spoke to the regional HHS office in Kansas City, and one of the comments was that they had met 80% of the expectations 2 weeks ago, and I asked what the expectations were, and they didn't know.
I'm not sure, Gene, are these anecdotes really positive, though? I mean, as James Taranto pointed out, the idea of seeing people in long lines the day before a deadline because they're being forced to do something kind of evokes bread lines in the Soviet Union. It's not really a sign of success, is it?
Well, it's only a sign of success if you're desperate to get a certain number of people, across the finish line. I don't think it's much of a sign of success, and we're not going to have any numbers here passed down from HHS to the state of Kansas, as I understand it, for at least another 2 weeks.
I was alarmed, James, by the anecdote. I was in the Kansas City Star of a man who'd been working his whole life, a construction worker, and he had never had health care for his family. So he came and he sat with the navigator, and they worked through all the choices, and he was surprised to see the plans. And they worked out what plan was best for him, what the deductible was, what that would mean. And when it came time for the premium, he was shocked, amazed to learn that he had to pay something. and pulled back. Like, you mean I have to pay? And the navigator asked him, I'm following the Kansas City Star story. Yes, you do. How much can you afford? And he was reluctant. She said, how about $5 a month? Yes, I can do that. So what we have here is an anecdote, but that's all we have, that whatever communication going on these last months for the administration of the American people was not successful, because a man who was clearly in the zone that the president and his party have been preaching these years, uninsured, hardworking man, wanted health care, hadn't been able to afford it till now, he comes to the table, doesn't know anything about it, and isn't sure he can afford more than $5 a month. Gene, that tells me that either the people of Kansas don't read newspapers, or the administration's success was entirely, and I mean this to be disdainful, between two ferns. It had nothing to do with the states of the United States.
No, I don't think so. One of the people that intimately involved with this out here gave me what I thought was an interesting little analogy, and he said, this Affordable Care Act is like a farmer's market. He said the HHS put up the tents where the farmers and buyers meet, but we don't know how many tomatoes the farmer sold. And that was the answer I got when I wanted to know how many people had paid the premium. And so it's a crossword puzzle in a Rubik's cube. You just can't nail down much of anything that's factual right now. Certainly not the ages of people and how.
Do
many
I need to mention that this is Kathleen Sebelius' state?
Oh, yes.
Is that maybe we
the HHS secretary?
We shouldn't leave that out. This is a state where she was governor. Right? And she returns to register her son. I remember her announcing that very prominently last September. Go ahead, Mary.
Can she return to the state, Gene?
No, well, I suppose she can, but I don't know, as there are many people were welcoming her here. But I would have to say, with that garden party, that mission accomplished party that they had in the Rose Garden, the person that's been catching most of the spears for this program didn't even warrant being up on the dais with the president, and was just a face in the crowd while the vice president was up there. And so I would think that the sell-by date for Mrs. Sebelius is approaching here fairly soon. So maybe she will come back to Kansas.
Mary, I want to press you on the politics here, because we're told that the Affordable Care Act will be the story of the midterm elections between now and November. We're also told that the Republican Party needs to have an answer or its own plan. However, I'm getting contradictory information about that. There are other voices who tell me, no, they don't. They don't need to do more than to say, when we have the Congress, we'll advance a plan that is successful and we'll negotiate with the president. Do you have an opinion on this?
It's interesting that you raise that, because we had Governor Bobby Jindal in today on the show talking about his health care plan. And what he did was lay out a number of principles. So not into the nitty-gritty detail, but just to be able to present to voters, look, here's effectively the outline of what we would think about doing, and here's why these principles work. I think that's a smart approach.
You mean as opposed to giving metrics which can be mocked by the opposition?
Right. It doesn't let the opposition take your eye off of Obamacare and train their guns on you, but it says to voters, yes, we are thinking about these issues and we do have a plan. I asked him, actually, by the way, if he's thinking about running for president. Right. He said he's thinking about it. No kidding, buddy. Kidding. Definitely.
This is Governor Jindal of Louisiana.
One bit of, John, one fact that I can leave you with, hard and fact numbers, is the Newman Regional Hospital in the small town of
Yes, that was a story yesterday. Please recount that, Chief.
Which is about halfway. Emporia is about halfway between Wichita and Kansas City. It's a small town of about 25,000 people, right on the edge of the Flint Hills. But that hospital announced that they're going to lay off 10 full-time and 5 part-time employees. And this is a quote, because of the negative financial impact of the Affordable Care Act.
Say again, Gene, how large is that town?
The town's about 25,000.
And they're going to lay out how many full-time jobs?
They're going to lay off 10 full-time, according to press reports, and 5 part-time employees because of the negative financial impact of the Affordable Care Act.
That's a lot of good-paying jobs in a little town, Gene.
Very much. It wouldn't be much in New York, but I'll tell you, in a town of 25,000 in the Flint Hills of Kansas, it's a lot.
Mr. Countryman, I did not ask you in general about the media attention to the president's "the debate is over" press conference in the Rose Garden. Was it positive? Was it negative? Have the people of Kansas moved on?
Oh, I think it was just ho-hum. I mean, it was just one of the television stations here carried it live. The others did not. And it sort of just came and went with,
blowing like tumbleweeds, huh?
Yeah, exactly. It was just sort of, okay.
Blowing through the prairie.
Gene Countryman, whom you can count on for a farming metaphor. You notice that tomato story he tells us. You can't tell how many tomatoes they sold. Gene Countryman of KNSS, The Gene Countryman Show. Mary Kissel of her own show. Opinion Journal each day at WSJ.live at 1 p.m. She's a member of the editorial board of the Wall Street Journal. I'm John Batchelor.